Hello, so this presentation is on cheap foods and the rise of obesity. Why are Americans so fat? A new study suggests we've been getting it all wrong. It's not that we don't exercise or spend too much time at the office, or that good healthy food is too expensive. Researchers reported Thursday. It's not about socioeconomic status, race, or geography. Rather, the main reason we're getting fatter, all of us, is because we are surrounded by tasty temptations that cost very little, from fast food menus to processed snack foods, said the study lead author Roland Sturm, a senior economist at the Rand Corporation and the professor of policy analysis at the Pardee Rand Graduate School. Up till now, researchers have focused on different groups, between rich and poor, between those who live states like Colorado, Mississippi, or between blacks and whites, Sturm said. But what we've really got to look at is changes over time for everyone, he explained. People aren't becoming obese because they don't have enough money or because Southern hospitality makes you fat. And they aren't staying thinner because they live in a mountain state like Colorado. This is something that cuts across whole populations. So this is the rise lately in BMI in the years between white women, black women, Hispanic women, other women. All of them are going up. Sturm reviewed that all the available research for a study published in California Cancer Journal for Clinicians and concluded that everyone, regardless of race, ethnicity, or socioeconomic status, is gaining weight at about the same rate. His graphs clearly show parallel tracks of increasing flab among all groups. If we want to solve the obesity problem, we have to figure out what has changed for everyone, Sturm said. And the thing that pops out is our food environment. That's where the action is. And it's not just that food is now cheap relative to income. It's also that it's so much more convenient. So here's now the lines for men. See, the men are kind of thinner and kind of like the one for Hispanic men kind of overlaps the white men a little bit and the black men. In the 1930s, Americans spent a quarter of their disposable income on food. The most recent data shows that share is now only 1/10. And while cheap, convenient food is a good thing, our biology and our social norms haven't caught up with the abundance. Foods that can be mass-produced and aren't perishable, like potato chips, candy, and sugar sweetener drinks, are prime culprits. We have a survival instinct that drives us to eat constantly because in human history, starvation was the problem. Also, our social norms are guided by that. We've been brought up to believe that it's nice to offer food to guests. It's like smoking. There was a time when it was practically good manners when someone visited to offer them a cigarette. Now this is showing the percentage of people over time who are eating food at home versus food away from home and percentage of disposable income. If you notice, the percentage of disposable income is going down. The food at home level is going down, whereas the food away from home is staying roughly the same, if not a little bit more. Some researchers have suggested that part of the problem is the inaccessibility of healthy foods. But the data show that fruits and vegetables, for example, have become increasingly available and affordable over the past decade. So I actually have a thing here for my picture that says, since the 1970s, the number of fast food restaurants has more than doubled. I thought that was like, wait, doubled? Like more than doubled? While Sturm allows that Americans could eat more fruits and vegetables, he argues that wouldn't make any of them thinner. That's because fruits and vegetables wouldn't replace other less healthy choices. They would simply be consumed in addition to everything else. But cost doesn't paint a full picture, says Marion Nessel, a professor in the Department of Nutrition, Food Studies, and Public Health at New York University, who was not involved in the research. This study attributes obesity to only one cause: low food prices. It does not discuss relentless marketing of cheap junk foods, nor does it discuss consumer price index, data on the relative cost of food, she said, noting that the cost of fruits and vegetables has gone up more than the average cost of food. The higher prevalence of obesity among people of lower income and education can be explained by greater consumptions of low-cost, high-calorie foods. Other factors that seem to play into the obesity epidemic are the rise of electronic entertainment, increased reliance on cars, and a shift away from physical jobs to more desk-bound ones. Although Americans aren't spending more time at work and have more leisure time today, they do spend more of that time sedentary, researchers found. Sturm may have offered up a new target, but he doesn't have a silver bullet to aim at. He suggests small tweaks to prod people to make changes. For example, taxes on unhealthy food choices. An economic incentive allows us to nudge people in the right direction, he said. It might be enough to start changing social norms. In half a decade, smoking changed dramatically, though we can't say that it's all because of taxes and indoor smoking limits. These tweaks probably helped. So this is a graph that I wanted to show of the 5 leading causes of death in the world in 2004. So you've got high blood pressure, tobacco use, high blood glucose, physical inactivity, and overweight and obesity. And overweight and obesity can actually cause physical inactivity. It can cause high blood pressure. It can, And this, I just thought was interesting too, is a U.S. kids watch hundreds of fast food ads per year, and it shows how many fast food ads kids between 2 and 5 watch, and 6 and 11, McDonald's being the number 1 by a large margin, and then goes down to Subway, Domino's, Burger King. Wendy's is probably the least for kids 2 to 5. For 6 to 11, it seems like Arby's is the least, But anyway, that's it for today. Thanks for watching.